and that. All right, after 2 years, you come back to the city again. They say, okay, it's about the same size, but you have to come back another 2 years. So that's continuous suffering, torturing, not only my experience, many of the others. So if I can move to the, so my interest in to share with you is how far we have health literacy. But after many years, Dr. Rima shared with bright us something we didn't understand, and now are we having a better world? There's a variations on health literacy, and people survey a lot of health literacy around the world, and usually we come up with a difference. Men and women, country. This is interesting in research, interesting to publish the difference, but interesting, how interesting this can be useful for a patient. Patients don't care about my country, how many health literacy my friends are. They don't care about that. Only research scientists interested in that. So I think not only see the difference, but how can we minimize the difference? Many do not know the health literacy. Still, many, for general public, they do not understand. How can we make them understand? It's so important. And health literacy in life course, in different parts of the life, people would need, but how much they need health literacy, and also how much health literacy will be satisfactory. No one is really 100% or 120% sufficient or proficient in health literacy. I don't know, because when people used to think, oh, they are very healthy, they have a good health literacy, particularly university professors or many doctors. But when they got sick, I have many doctor friends, they got sick, their health literacy suddenly dropped to zero, right? Even very good doctor in psychiatry, they also have a lot of problem on mental health. So what are the satisfactory? I can have next one. All right, this is a show exactly 40 years ago, and I was with this is Dr. Jack Lindo, yeah, and I was appointed as ombudsman by President Tsai, lady president of Taiwan many years ago. So I was thinking of this constantly, see how health literacy would be beneficial for many. Next slide. Sorry to ask you about. I'm thinking that people, we were, through evolution, we were walking in the jungle, we become more sophisticated in our life, and then we don't know when they got sick. We don't care about when they got sick. They got the leg broken, we don't know. But now we care about when people are sick. So we build up big hospitals. We build up village hospitals that we can take care of the people when they are sick. Apparently it's not enough. It's not. Can I have the next slide? So one of the important lady, Nightingale, in 1960, the title of the article is a Hell on Earth Hospital. A lot of hospitals, really, by the time it's the best hospital. But Nightingale said that patient be active participant. I think that is following the same guideline Dr. Rima just said that. Patient has to be active participant. They cannot sit there or lying there doing nothing, knowing nothing. It's not good for them. But unfortunately, many hospitals, many health settings, please rest there, please sit there, just wait, okay? Until 2 days later they come back, right? So that's a problem. She said that be active participant in hearing, not passive recipient. And then she said educate the public on home care. Interesting. Now, after many years, we put patient on a big hospital in Taiwan, maybe many other. We want the patient to go home. Don't go to the big hospital until the last time. And she also advocated careful, simple, and direct communication. Exactly what we are talking about, health literacy. Ensuring patient and caregiver understood and necessary and take necessary action. I think it exactly mimic what you just told us, right? So that is a component of modern health literacy. Next slide. I have two example myself. I visited Swatini a couple of years ago, and they have a WHO set up a central lab. Patient having HIV tested by the motorcycle, cold chain, and send a blood sample to the central lab in the capital. Good, right? And they have a report. The report only come back to the clinic 2 weeks later when the motorcycle come back. So I will visit the hospitals. Hey, people are waiting for the report. So we did a very small to put a mobile phone receiving the report. That's very simple. And you see the hospital setting up a barrier, not giving the report to the doctor, to the patient, right? This is totally global health subject. And it's the same, it's the health literacy, right? People need to know what is my blood count, and they can take action. So that's the first one. Next slide, I visit Malawi, and they have a high HIV, but they don't have a patient record system, not electronic, just paper record, nothing. So patient come here, take a blood test, and they took the medicine, and they took the medicine, but the medicine was rare, expensive by the time, so they only take half of it, the other half it give my brother to sell in the market, right? So, there's a problem, so we just offer a fingerprint. This fingerprint represents the patient ID, and that's very simple one, right? We published in the Lancet. Very cheap study article. But anyway, this is a health literacy, because without knowing what effectiveness of the medical care, we don't know how to really improve the service. So first part I would say, and actually I'm challenging myself all the time, we have a lot of tools. Do we have enough tools? We have 150 tools of survey, different kind. And these two come up result. This is a European study, 10 countries. You see, they are different, right? Some countries are good, some are, but only even with very good sampling, you can tell which country is better the other. But that's only last year. Next year, in different parts, people are moving, right? So they tell the difference. Politician, health department minister, sensitive about this kind of result. How do they take action? The minister do not know how to take action. All right, I give more money to the community and give them teaching material, better quality, whatever. Next slide. And you can see this kind of report around the world. Dr. Angel President was very active in moving this survey around the world. Helping people to understand important to survey health literacy in the general public. And in 2011, there are some country, some area, people are more aware of health literacy because they say, oh, I have to do some survey about my public. Next slide. And you can tell different, this is another study, different ethnic group, Asian adult, Native Alaskans, Hispanic adult, they have a higher percentage of low health literacy. Okay, we are happy or not happy? Usually we are not so happy, but we are happy to have the paper published. Next slide, please. And you can tell more. This is interesting study. See, Turkey in 2011, all right, 80% without good health literacy. All right, I'm sorry, you have to improve it. But in China study, they have 2 times. In the beginning, they have a very high, but then in 2022, they have very low percentage of low health literacy. Wow, good, right? We spend the money to helping people. And you see that even Taiwan is high in the beginning, then going down. It's kind of stimulus that every country, if they read the article, say, let's better make our people. And usually, then stop right here, no more. After 2 years, spend some money, people stop. Next slide, please. We did 8 countries in Asia comparing different. So they use the same tool, but methodology may not be the same. You know, Asian is a big country. We published that. We are happy, but I'm not very happy. Later on, so, can we change it? Are we making people more different, or we're trying to improve their health literacy? Next slide. Okay, so now I want to go really, Dr. Rima mentioned action. How can we do it, right? We know people are low health literacy. When they are young, low health literacy doesn't mean they are suffering. But when they are getting disease, they really start to suffering. And so this is a recent study, summary report in Sri Lanka. They have a first e-hospital. We like that, okay? And people start to spend a lot of money on knowing health, but knowing health. Next slide. And this is economy impact. A little bit complicated. They compare USA, which is where they have adequate access to health information. If we want to improve their health, we need to give them information, right? Without information, people say, "Oh, I don't know HIV is dangerous. I don't know lung cancer will kill me," right? So you need to provide. At least you give them information. And USA is the best. Mexico, good. Australia, Canada, Slovenia, but Bangladesh, India, China, very, very low information, inadequate information on health. So first we have to give them sufficient information. And how to give sufficient information? There are many ways to do that. And depends on different generations. Gen Z, Millennium, they have different observation of health information to them. This is by economic metrics and impact. So through time, information in the society, wherever they are, in a textbook, in a classroom, or on the social media, internet, they are having different reception. People feel you have enough health information. I think in Boston, everyone has quite happy about information, more than you like, okay? If they are cheese, if they are pizza, everyday cheese and pizza, you adapt to it. You don't feel, but you like to have some sushi sometime. You like to have a wonton sometime, right? The variety. So health information, how they can be interesting. People can take advantage of it. That's a question. But at least we need to provide some information to doctors, social media, and the others. Next slide, please. And this is access to, and they have information. Do they have access to? It's a tool to access it, but some people do not have good accessibility. So usually, I feel empowered to make sure decision with doctor. So some feel they still don't have a good way to deal with that doctor when they discuss with the health. Next slide, please. So this is literacy, learning disability about the health, and difficulty with communication. This is a global comparison that make communication with healthcare profession difficulty as a landmark. Do you have difficulty to communicate when you feel like you need to consult some health expert, doctor, nurses, pharmacists, technicians, and can affect the ability to make informed decisions? If you have a good communication skill, you might get a better treatment or shared decision making. And there are some countries good, some not good, but this is quite an area. You look at the global picture. Next slide, please. So I want to move to the policy. We know they are different. Some are good. Some country, Massachusetts might be better than the other state, right? For sure. And different part of the country have different health literacy level if you go to survey. But how the government, how they know it, but how to change it, right? Policy effort to build more health literate population are not yet translating to outcomes. And that is the homework, one of the homework, if that is the message. It's still not so good. Even we do a lot of research, we do a lot of analysis, what the government can do. That's come to many countries' mind. And by different health insurance, different insurance, you could have different impact of health literacy. Next slide. This is by some quote by a manuscript from Dr. Rima on Dr. Koch. So actually that was a quotation on what you have achieved. Next slide, please. That's the same one. And the message is that Dr. Guo, he was serving as a colleague here. He said, what is your understanding of what you have and how are you feeling about it? That's a very simple one. All healthcare providers should first listen before speaking. And that's actually a landmark. How do we know our partner in health service, a patient? Do we know how they are good or adequate? Just like a teacher asks a student question, in case you know, oh, they are not good in one area, some part they are good, right? So without understanding, we cannot offer health literacy. The government, if they do not understand their people, they don't listen to them, they will not know where they can fill the gap. If I can go to next. And I'm saying this is because it's not new. It's very old already. Amata already said that. I'm reading this is repeatedly, right? Nightingale, 1860. People have a right and duty to participate individually and collectively in the planning, implementation of their health care. It's 1978 already, right? Another one is a long time ago. So we know that. But how much we achieve? That's the homework. Next slide, please. So people start to do survey on health literacy here today, different population, different country, different language, culture. All right, we know they are different. Government do not know how to effectively change it. Even European country, they continue to do health literacy survey, trying to find intervention, but we don't see too much difference. You continue to see the difference. Those poor are still poor, okay? Those good, without doing anything, they are good. So another thing is that we provide information. We're trying to provide more information, and there are many channels we can provide information. But the problem now is, are we overfeeding the information? Are we feeding over information? If we eat 3 times a day, some people can eat 1 meal a day, some people can eat 4 meals a day, but if we feed them 8 meals a day, every 2 hours you feed, they would not happy about being fit. So there are a lot of information, too much information at this moment. A lot of information. So there are different terminology about this too much information. I mean health information. And there are a lot of problems. And if people are having too much health information offer, or they come to your mobile without your permission, they come to you because they want to sell you something. They want you to do this and that, buy this and that. It's a lot of information. And can we choose the good information to take it, and we would neglect or we will not receive those information we don't like? For example, I like information from Harvard University Chan School, right? But there are many other information come to me, right? They say, oh, their information also good. Can we choose? Not easy. Social media, as I know, I cannot control. I have to read a lot of useless material, and means there's no regulation. Not easy country. I don't know, Professor Tsai, how to. I just look at whatever I like, but a lot of people fit me with the tool. So they are proven of over fit information. Next slide. And another thing is that because we are in the AI period, we are with ICT. Many people want to use ICT to make profit. They go to a healthcare system. They provide a lot of information, and a lot of information just like this kind of building. Sometimes they build up. A few years later, broken. No one buy it, right? This is old building in construction like that. Information system also like that. They want to use the technology. They want to make profit. They create a lot of information. They want you to read it, to buy it through the information sharing. And then we don't have a good choice how to guide through this information jungle, if I say that. We want to go to the garden. Actually, I was lead to a forest or a desert. That is the situation right now to me and to many others. We have a lot of information, but are those information good information for me, for the individual, or for someone in need? And if you don't read that message, you don't know that information is good or not, right? So you have to read it. At least you have to read something. Next slide. So quality of health information is the issue. And there's a study about regional health information and literacy. And for those with high and low health literacy, the quantity and quality of health information they would like to take it or they can take it are very different. But we know very little about what are good for them, right? And we usually say one medicine could be poison for another one, right? You all know this, right? I cannot take the information from Dr. Tsai and it will be good for me. We are so different. Even the same family, they are having different need of health information and literacies. Next slide. Okay, so we have more complication from the current situation. Internet, so good, right? Internet is so good, but there are a lot of internet gap already. So disregard of the quality, just quantity of information from internet. And internet already in our society for 40, 50 years. We cannot stop it. And so there are secondary digital divide, if I can make it. So that is one complication about health literacy. If I can have the next slide. Thank you. And now social media is more popular. I still use Facebook, but none of you use Facebook. They say that if you Facebook means that you are more than 60. I don't know you use Facebook or not.
I do.
You do, right? Our kids don't use. They say IG. Something straight up.
Straight, yeah.
Immediately we are having. So YouTube is so much one of the best classroom for medical information if they are good. But I read a lot. I was traveling with people in different parts of the world, and on the train, everybody look at the YouTube, right, or Facebook. Most of them are on gambling. They don't really serious watching how to running or walking just like you doing that. How much calorie you take? No, they don't take care of that material. They are reading those things. So digital social media is a problem. I don't know. I have to seek your advice that how can we manage with they are over here. We cannot cross them. We cannot shut down. We cannot give them up. They are with us. But are they good for health literacy? That people can be better prepared to take care of their health? I doubt it. I personally doubt it. But anyway, that we have to study that. Next slide, please. So AI now. AI is here already. many years. Now it's more popular. Patient bring AI to the doctor. Say, okay, I read this. I don't know AI good. Even they are a very good person, knowledge. A lot of people, they ask AI many times. They use ChatGPT, Gemini, different. They come out different opinions. So Dr. Aya, I read ChatGPT say that I have to walk 8 miles a day in my body weight, but the other say 2 miles and eat Coca-Cola. And which one is good for me? AI, ChatGPT, other teacher, professor, who is better professor? Most of people cannot judge, and they are already in our society. So critical health literacy important, very important, but we are not prepared to teaching in the elementary school or public school. Okay, I'll come to the last part is that health literacy. Many people ask, what is health literacy? Easy to put that English, health and literacy, right? In many other countries, Vietnam said, in Vietnamese, no health literacy, how to translate? And in our society, we have two. We also have a two definition of health literacy. And many Indonesia, they have many different languages. Some don't understand health literacy because it's not in the culture. It's kind of new invention. It's like a X-ray machine. It's a new invention. I dare to take, but I like the idea that Mr. Wang Yangming. He was in 1472. He was a good scholar. And he said that if you put it, if you understand Mandarin, it's a 知行合一, knowing and action have to be combined. He is a revolutionary. Most of the people at that time just knowing, doing nothing.
Yeah.
But he was well known because he said, knowing is not enough. Only action would help you. Okay, would help the country or help the kingdom. So he was in mind. He created some. Drone by the time. Well, fire truck.
Fire truck.
Okay, so I feel like that health literacy is very important, but most critical at this moment after we working on health literacy for a couple of decades, how to take action, how to help the government or tell the government or tell the health district to take good action is critical. Next slide. So only by take action. Without action, I think so. Health literacy, the action part may be 80% of whole thing, right? The other is not 20, no. Only, I would say knowing is much easier now. Nowadays, because information is so much, knowing something is very easy. Take that action is very, very difficult. And so, if possible, we need to create a tool or to teach people how to take action. For example, you call your friend that tomorrow we walk 2 kilometers, 3 kilometers together. And he will say, no, I would like to eat it without sleep and don't, but that is really most difficult. How to take action. Without action, we cannot help the people. And so we create, next slide, we create a classroom recently, how to offer applied health literacy skill to healthcare profession, not to the public. We teach doctors, nurses, pharmacists, social workers, home care, how to improve your skill, just like a professional training, how to talk with your customer, how to talk to your mom, grandmother. You have to do something. And there are many language issues, there are many action, understanding, empathy together. So we are doing right now from passive knowledge to active behavior. We are right now in my society in Taiwan. We want to do that. We want to go to the other part of the world said how to do that. We need a very simple training programs to teach the healthcare profession. Next slide. Sorry, my time is so. This one. So now we have AI. AI may help the global health work to climb up. We have many champions. They are experts. They are professors. They are in this area. But we need a teamwork. The teamwork has to link us to the highest mountain to be safe and essentially come back. So we need a good teamwork. How to make that teamwork work? That's the reason I come to Takimi, right? Next slide. Last one. So we create AHLA, Asian Health Literacy Association 2013, and every year we want to call up people to work together, find a way. We don't work in the area. We want to work into community. This year, November, will be in Thailand, in Chiang Mai. We have to work with them. How do you do your education and training? How to mobilize your community people to work together as a fashion. You know, Thailand people like to have a lot of fashion. They like to work together, teaming up. So we do that. We don't think we are quite successful yet. We are not satisfied with what we are doing yet. That's the reason we need more of the people interested in health literacy, interested in helping people understand health literacy, and interested in how to activate, how to take action in their daily life, in social media. We have to use that. How to tell the AI industry that we provide good action planning. Now ChatGPT, you ask them something and they say, do you like me to do you more? Yeah, that is a good idea. We need to work with this AI conglomerate to see whether when people think about health, okay, maybe if someone said, okay, where can I buy good quality cheese? And the AI will say, okay, do you like to know what kind of content of cheese would be good for your heart? Right? Why don't we do that with the AI community at the company? Say that always put health in the center of their business or the service, if that is possible. So we are working on that. But thanks to you and Aya and many of people, faculty in Harvard, is bring this torch so high, just like Nightingale, 1860. And I hope you bring the torch higher, bring the lamp everywhere, here and there, to shine up. And I hope health literacy is one of the substance, the content we can share with many parts of the world. Thank you so much. I will take any question. Thank you. And sorry about the okay.